Hi, I'm Dr. Casey, and this is my first ever YouTube filming extravaganza, whatever you want to call it. I'm in my new Brentwood office, which I'm so excited about. So also check that out. If you're in the area, come by and have a visit. But today I'm going to be showing you how to foam roll, full body foam rolling. This is what I show a lot of my patients. I usually do some specific stuff with them, but if you're interested in doing like a full body foam rolling experience or learning how to foam roll beginner, this is going to definitely help you and show you all the different tools and things that you need. Make sure you subscribe, hit the like button and the little bell notification, all those good YouTube things, so that more people can get to enjoy and experience all the knowledge that I can give you guys. So first I'm gonna be showing you foam rolling. Like I said, I like to start with the mid back first. So first we're gonna start with the mid back or the thoracic spine. So you wanna make sure that you interlace your hands behind your head and that your elbows are relaxed and they're not closed in. So keep that nice and open and relax that head back, but stay supported so that you're not like dropping all the way back. To help you move up and down the mid back, you lift your butt up just a little bit. You keep your feet flat on the floor, whether you are wearing shoes or you're barefoot, whatever you feel like is the most comfortable or the easiest. You're going to slide up and down here. Got the fun foam rolling noise here. And you want to do about up and down 10 times. And then from here, I like to go into what's called a thoracic spine extension move, where you pick a spot in the middle of the thoracic spine or mid back. Again, interlace your hands behind your head and you relax all the way back. And again, you're keeping your core nice and tucked and you're not flaring your low back and arching your low back too much, so that this is nice and relaxed, and really drive those elbows out and you feel that stretch. And you want to hold here for about 10-15 seconds, nothing crazy. And then you can move up, you can move lower. Again, I'm keeping core tucked as much as possible so that I'm not arching the low back. That low back is staying in a neutral position. So then from here, I just like to roll to the side so I can get my serratus and lat muscles here. So just the muscles along the side, really good for anyone working a lot of shoulder. Just another way to get mobility and circulation though. These are actually really uncomfortable, but they're really good for you. Again, up and down about 10-15 times, or if you like to time it, you can do about 30 to 60 seconds. Again, each area shouldn't take that long. And this you can also do before or after a workout, or in the morning or at night, whatever is your go-to. Then I like to go into my neck, just so we can keep working up here. Now you're gonna move your hands up to your head, and you're gonna roll all the way down. And from here, you can relax your arms by your side, whatever's comfortable. And you're going to look each way. So this is gonna help you work on rotation in the upper cervical area or the base of the skull area, and also just get blood flow to that area. It's kind of like massaging the back of your neck. I love this one. Make sure your hair doesn't get caught underneath the foam roller. And then from here, I like to move it on down to my calves. There's so many ways to do this. The way I like to do it is put one leg over, so you're adding extra pressure. And you actually don't really have to lift your whole body up. You can just move your arms and your butt can slide with it. You don't have to lift it up. If you want to, you'll get more pressure, but make sure your shoulders are not coming up to your ears. This should be like more relaxed. And you can get different angles of your calf too. So you can get the middle, the inside, and the outside. So you just lean the foot and the leg each way. So this is great for getting that circulation and blood flow to the calf as well. And then always do both sides. And then from here, I'm gonna go into the shins. These are really good for people who have shin splints or just to get blood flow to this area. So easiest way to do that is bend your knees. You're gonna lean over, put your hands down, kind of like you're going in a tabletop position, and just use your hands to guide you. This might be hard to start if you're working on any balance or coordination or anything like that. So don't worry about making this like a staple in your foam rolling full body mobility routine, but it's just another added benefit or another way that you can work on shin splints. So again, up and down 10 times. And you can lean each way to get more on each side. Then I like to go into the glutes. So just rolling up and down and then leaning each way so you can get the outside of the glute, what's called the glute med or the TFL. You do not have to do the whole IT band. The IT band is a thick white connective tissue that is actually really hard to go through. There's a lot of studies showing that you're not really breaking up the tissue. You may be getting blood flow to the area, but it's not like working on that muscle because it's a thick white connective tissue. So that's why I just like to focus on where everything originates, all the muscles are originating from, or where they insert, so that where the knee is. So you just roll to your side. This one, again, a little bit more working on your balance, but you put your hand here, or you can go on your forearm and use these legs to guide you. And you're putting all the weight on the outside here. Again, up and down 10 times, and see how I'm moving this leg, bending it to guide me. And then we're gonna go do the other side, of course, always both sides. Even if it's only one side that's bothering you, you always wanna do both sides. So again, you can use your hand or you can use your forearm. And again, I'm just going on that outside of the glute. Then I roll over onto my stomach and I'm gonna get my quads and kind of adductors area. So this is a little bit more working on balance, stability, but you can use forearms. You can go hands flat and you just roll and use your hands to guide you. Sometimes you are having to brace your core because you're, again, moving in different positions. And then if you feel like you want to get more on one side, just lean your weight more using your forearm and your hand. So now I'm focusing only on the right side or focusing only on the left side. I'm basically putting like 90% of my pressure on my left quad versus my right. So I wanted to go over different foam rolling tools. There's so many out there, and whatever you have at home, whatever you use, whatever is easiest to use is going to be your best bet. So you don't have to be all fancy and get 10 different things for one area or 10 different things for each different part of your body. You can get one thing and you can use them for everything. You can use a trigger point ball like this, a double ball. You can use half a foam roller, which sometimes is easy to travel with, or these might be easy to travel with too. Or you can have a full-size foam rollers, which I show you on, but again, you can do almost anything on any of these. So these are great to travel with, and then this is great if you're going to and from somewhere locally in your car, or for at home or at the gym. So this is a full body foam rolling routine that you can do either before or after a workout, or you can do in the morning or at the end of the day, whatever you feel comfortable with, but it's an overall great way to increase circulation, increase mobility, prevent injuries, basically all of the above. Thank you so much for watching. Please make sure to subscribe right here and remember to hit the bell notification to be reminded of future videos. As always, move well first, then move often. Thanks again, and I'll see you soon.